Hypertension is a very it's a very wide spectrum of disease. It's not like a single spectrum of disease that we can address. It is a very wide spectrum of disease. So if you ask me about the exact definition of blood pressure, it is increase in the pressure in the heart causes is known as high blood pressure. So the average normal blood pressure that we have is around 120, the upper blood pressure, and the diastolic, which is known as the lower blood pressure, should be somewhere around 80. So anything above 120 by 80 is considered to be as high blood pressure. There are certain symptoms through which patients do present to us with high blood pressure. The first and foremost, the symptoms, it could be heaviness in the head, throbbing headache, heaviness in the eyes, vague chest pain, uneasiness, or restlessness are the various complaints through which the patients usually present to us. And at times, patient does not have any symptoms. They do not have any symptoms and signs, but they do present with high blood pressure. That too as an accidental discovery, or that too as just like a random checkup or a random accidental discovery. Anything above 120 by 80 is considered to be as high blood pressure, and any blood pressure which is less than 80 above and lower than 50 and 80 by 50 is supposed to be low blood pressure. So the symptoms are also different, because in high blood pressure the patient may feel little restless, may feel little uneasy. There might be headache, there might be uneasiness, there might be vomitings. Whereas in low blood pressure there is more of a fainting process, or the patients feel little weak. They have more fainting episodes. For example, suddenly they just collapse or they fall down. So that's how we differentiate that the BP is on the lower side or that the BP is on the higher side. The first and foremost risk factors is sedentary lifestyle, high intake of alcohol, high intake of smoking, disturbed sleep, stress, anxiety, obesity. These are all risk factors to develop high blood pressure. We ask the patient to sit down, relax himself, and then we measure the blood pressure. So there are various cutoffs that we have for blood pressure. Blood pressure, if a patient is having a blood pressure of 120 by 80, we consider that blood pressure to be normal. If the upper blood pressure or the systolic blood pressure, which we call in our medical language, is 150, is between 120 to 129 upper, and lower is 80 to 89, is called as stage 1. Stage 2 is said when it is more than between 130 and 139 upper, and lower is between 80 to 89, is known as the stage 2 blood pressure. If anything above 140 upper blood pressure and more than 100 lower blood pressure is known as stage 3, and that's how we basically diagnose. There are two types of blood pressure. One is essential blood pressure, and second one is secondary blood pressure. Essential means which essentials or idiopathic blood pressure means that we do not have a cause for blood pressure. It just happens. Secondary causes means that, for example, if you have any other diseases, for example, like you have any kidney disease or any hormonal problem or any brain issues, or with any endocrine problems are associated with it, they might reflect as high blood pressure. So blood pressure which are associated with other diseases of the body, we call it as secondary blood pressure. But blood pressure which are not associated with any of the diseases in the body, we call as primary blood pressure or essential blood pressure. Control is the only method through which is existing, because we have tried personally at our level to actually get back or to cause the reversal of high blood pressure to normal blood pressure, but it only happen in those patients who are very disciplined or who have a strict control over their lifestyle. Their medications have actually been withdrawn, and they are still doing, and they are maintaining their blood pressure through lifestyle changes and modifications. But it works both ways. It works if you are well disciplined, you are taking your medication, you are well disciplined in your lifestyle, you are well disciplined in your daily activities, then you may after certain time may not require medication. But the population, you have dual population, you have mixed population. Some people are doing it properly, some people don't do it. The dietary changes that we require, that we tell our patients, is to reduce, is to optimize, not take too much of salt, or take an optimal level of salt, like for example 1.5 grams of salt in the entire day is considered. Secondly, lifestyle changes, for example, like brisk walk, any physical activity, running, gymming, yoga, badminton, cricket, football, anything which they of their all, whichever they like, they need to incorporate. Yoga itself is helping a lot of people to cure blood pressure. In diet, for example, I usually personally recommend my patients to take more of salads, more of green leafy vegetables, more of dietary fibers to be incorporated, less of unsaturated fats. Avoid low high cholesterol diet, high fatty diet, and oily diet. These are all the preventive measures that we tell our patients to take it during the for reduction and for prevention of blood pressure. We can prevent high blood pressure. It is not always necessary to take blood pressure medications, because if you are incorporating a healthy diet in your lifestyle, you are modifying your lifestyle, you are disciplined in your lifestyle, you have a proper way of eating, you are eating a balanced diet, you are not smoking, or you don't have any risk factors, your family, there's no family history associated with high blood pressure, so you can prevent high blood pressure. So these all factors are preventive ways to prevent high blood pressure. But once, if in case if the patient doesn't do this, or patient fails to incorporate this preventive measures, then there is no option left, and rather to start with medications.